Dr. Campano offers the most advanced SmartLipo triplex system, which offers even better melting of fat and tightening of skin, using multiple wavelengths of laser energy to give the optimum results than previous versions of SmartLipo.
Dr. Campano, you're doing SmartLipo. Now, you happen to be the first person to do it in North LA and Kern counties. What is it?
It's a great technology. Actually, I read about it in a tabloid magazine about a year ago, and it's been done in Europe and South America for about 8 years. It's a laser that actually melts the fat. It's true liposuction, where I melt the fat and then I suction out the fat in a liquid form. However, it's great technology. I initially was interested in it for the delicate tissues of the skin. I do standard liposuction, but because the skin is so thin, sometimes you get some divots and channels. The surface is uneven. With the laser, I can actually tighten things up, and so you get a smooth surface.
Doctor, before the show we had talked about the analogy of butter. Could you please use that now?
If you think about a hardened lump of butter, I take the laser and insert that in, and initially I meet resistance because it's firm. Then as the laser energy is melting that fat, it becomes like a liquid margarine, so that all that fat is in a liquid form, and then I go back in and suction it out. There's a minimum risk of lumps because the laser energy tightens the skin. So I do 3 types of passes. I go into the middle level of the fatty tissue to melt the fat, then I go deeper to melt the deeper fat, and then I go just under the surface of the skin with the laser to tighten all that area. With standard liposuction, you use a very large bore cannula, and you go in and you make these honeycomb channels. In between the honeycombs, the skin dimples in between when that is all removed. So with this laser, the fat isn't removed in that manner, the fat's removed in a more even manner. There's minimal bleeding. I can do it in the office. It's minimal pain. And as opposed to the 4 to 6 weeks of oozing that potentially can happen after liposuction, you use these compressive garments just for a few days. You can theoretically be back at work the next day.
I want to go back, Doctor, to the reading about it in the tabloids. You actually did more than that. You read in the tabloids, but you brought it here. You brought the technology to us.
I kept track of the procedure, and it was FDA approved for this country in December of last year. And then I went to training courses, and actually am the first in the Antelope Valley as well as all of Kern County to perform the SmartLipo procedure.
Who are the preferred candidates for SmartLipo?
Liposuction should never be used as a weight reduction technique, but people who are in shape and have certain areas that they just can't quite get rid of, then they're perfect candidates. It started actually, I just was interested in the neck, and then my friends and some of my patients were begging me, please go lower, because a lot of my friends have had children and they are in shape, they exercise, but they just can't get rid of certain areas. The areas under the triceps where you wave and it continues to wave, the belly, the hips, the thighs. Actually for men with what we call gynecomastia, male breast tissue, it works well for that as well.
Doctor, being my personal physician, there have been times where I had to get a hold of you and it was an emergency and you called back. And one of the other neat things is that you actually live here in the Antelope Valley.
That I do. Live and work here.
There's one other aspect that I want to just bring up, and that is when somebody comes to have SmartLipo, or they're going to have a Botox shot, or they're going to have their sinuses checked, whatever it may be with all the specialties that you specialize in, who's going to do the work, you, or are you going to have office personnel do it?
When people come to my office, any invasive procedure will be done by me. I take personal satisfaction in a job well done, and when people are out there walking around with Botox or a filler, it's my name on their face, and I want to know that it was done right.